Let's talk about febrile seizures. So the differential diagnosis for febrile seizures are the following. A non-epileptic event or movement, so something like pseudoseizures, provokes seizures from CNS infection, epilepsy, or a tumor or central nervous system insult. Predisposing conditions for febrile seizures. So usually the patients are less than 5 years of age with a peak incidence between 12 and 18 months. There's usually a high fever with it. There can be a viral illness that happens and causes the fever. Human herpes virus 6 is the most common type. They can have a fever from a recent immunization, such as with the DTP and MMR. And there can also be a family history of febrile seizures. Clinical manifestations. So febrile seizures are broken down into two types, simple and complex. Simple seizures are usually generalized. They last less than 15 minutes and they do not reoccur. And their duration usually is in the 3 to 4 minute time frame. The most common type is generalized tonic-clonic, and the post-ictal period will be shorter. Complex seizures are focal or prolonged, greater than 15 minutes, or they are recurrent within 24 hours. And then there is a phenomenon called Todd's paresis, where this is a transient hemiparesis which may occur during the post-ictal time frame. Evaluation. So the key with evaluation for febrile seizures are did the patient return back to baseline on their physical exam? And if the answer is yes, then you just treat or you evaluate for whatever your exam tells you to evaluate for. But if they don't return back to baseline, then you need to do more. And so what this slide is saying is that if you have a documented fever greater than 38 Celsius, so that's 100.4 Fahrenheit, and the child's between 6 months and 5 years of age with no evidence of CNS infection or inflammation, there's no metabolic abnormalities that could produce seizures, and there's no history of afebrile seizures, and again, your exam is normal, then you can just direct your evaluation towards your exam findings or your concerns for the fever. Children with complex febrile seizures who are less than 12 months of age, we do get more concerned about meningitis, but it still may not warrant a full evaluation if they have a normal exam. Typically, EEGs and CT scans are not indicated for further evaluation. So this concludes our talk, and let your team know if you have any questions. Thanks.